Hello, hello. Welcome to Warriors Talk with author and founder Lady ReShell, where we move away from awareness towards action. It's Health and Wellness Monday, and our topic for today is the impact of cancer treatments on your heart. We are live from the home front today. On the last episode of Warriors Talk, I talked to Marilyn Miner, and we talked about the power of advocacy. You can go to YouTube and type in Intellectual Radio and stay connected for any episodes you may have missed. The quote of the day is, above all else, guard your heart, for everything you do flows from it. And that comes from Proverbs 4:23. This is still Black History Month, and we want to celebrate Henrietta Lacks. She was born in 1920 through 1951, and she is the woman behind the HeLa cells. And her cells were taken without her consent, and they became the first immortal human cell line. HeLa cells revolutionized medicine, aiding in the polio vaccine, cancer treatments, and AIDS research. Her case highlighted racial injustice in the medical ethics and patients' rights. So without Henrietta Lacks, we would not have such treatments as AIDS treatments, cancer treatments, and the polio vaccine. We are grateful for our sponsor on today. We have Pastor Michael Richardson, who has a special message for us.
Greetings, I am Pastor Michael Richardson.
And I am First Lady Anastasia Richardson from the Emmanuel Church of God in Christ. We're located at 3058 West Van Buren in Chicago, Illinois. We are building upon a solid foundation.
And we're inviting you to join us every Sunday morning on Facebook Live at Emmanuel Kojic at 10:15 Central Standard Time. And you can also view our videos on our YouTube channel at Emmanuel Kojic-MR. Once again, this is Pastor Michael Richardson
and First Lady Anastasia Richardson, and we're from the Emmanuel Church of God in Christ. We are building upon a solid foundation.
We are so grateful for our special guest on today. We have none other than our Healthy Solution expert with over 20 years experience as a family physician, and she is impacting lives every single day. Welcome to Warriors Talk, Dr. Michelle Meeks, MD. What's up, Doc?
Hello, Lady ReShell. How are you today?
I'm good. How are you?
I'm doing well. Happy Monday. It's finally warmer. So.
Oh my goodness. And I can't believe we're already at the end of the month of February. It seemed like it just went by so fast.
It did. As slow as January went, February went just as fast.
That is so true. But we didn't want this month to go out without talking about something that has to do with the heart, because we know February is American Heart Month, and the heart is important because without it functioning, we know that we would not be here. So I think this topic is important, especially for those who have went through a cancer battle and you had cancer treatment. So we're going to talk about the impact of cancer treatments on the heart.
Yeah, an important topic we don't think a lot about, right, is the heart and cancer. And we know heart disease is the #1 killer in the world and in the United States, but it's unique when it comes to patients who've undergone cancer treatment.
Yes, I saw a study that said more than 3 million cancer patients, they found about 1 in 10 die from cardiovascular disease. So when I was going through cancer treatment, I know that they did, they had me to go through, I think it was a heart, I don't want to say an ultrasound because it was more than an ultrasound.
An echo, maybe.
An echo exam. I had to lay still. I remember them telling me not to move. And I think it took about 45 minutes for the test to be done. And then they were trying to see if my heart was healthy enough to do the chemo. And so got through that. And of course, it was healthy enough because I ended up going through chemo. But I don't remember doing anything after that to see what the heart was like once I went through chemo. So when I saw this subject, I'm like, oh my goodness, like it does do damage to the heart, but we just don't know how much and when it'll show up.
Yeah, that's such a good point you bring up, because when we think about patients who are undergoing or beginning treatment for cancer, we have to think about before, during, and after, right? And so before we start these treatments that are so effective in treating cancer, because we know that when we are killing those cancer cells, we can also be damaging other organs. It's important to make sure, first of all, that you don't have heart disease or at risk for it, because one of the things we want to think about when we talk about prevention is get yourself and keep yourself healthy now. So when and if you ever have to be in a situation that would increase your risk, like, God forbid, having to take cardiotoxic chemo, that you are already in good health, like you, right? You were already in good health, so you were able to get those drugs to treat your cancer. And then when you're going through chemo, we know that those drugs can in some cases, cause harm to the heart. They can cause irregular heartbeats. It can cause chest pain. It can affect the muscle of the heart and how well the heart pumps. And so all those things are important to know, are possibilities. So if you have symptoms, if things change, you don't feel as good, that you bring that up to your provider.
Yes, I found it kind of funny because it was saying that the cancer itself rarely has a direct impact on the heart. So you would think, oh, this cancer is in my body, it's just doing a lot of damage. No, it's not the cancer. It's the treatment that you're receiving to get rid of that cancer that is wreaking havoc on your entire system.
Yeah, we don't really see primary heart cancer, right? We don't really see that, but we see the effects of cancer treatments affecting the heart. And that's why, because when you have cancer, you already may have symptoms that can be very similar to if you have a heart problem, right? You're already fatigued and tired. Maybe your heart races, because of the chemo that you're getting, or anxiety about your cancer. But those can also be signs of something going on with your heart, right? So hopefully when you are in that battle, that your provider and your doctor is asking you certain questions to be able to elicit, are there any changes in how you're feeling, right? Is something different today than yesterday? Are you having weight gain, swelling in your legs, palpitations? All of those things can signify a heart problem. And it's important to catch these things early, because we know we can keep them from getting worse if they're impacted. But many times people don't think about it, right? They're like, oh, I'm done my chemo, I'm done. And they don't think about sequela of that chemo.
I saw somewhere where it said that if you're going to go through chemo or cancer therapies, you should also be seeing a cardiologist as well going through it, so they could be checking you, I guess, throughout that cancer treatment. But I don't remember any other survivors mentioning anything like that, unless they had an issue beforehand and they had to be on alert for it. So I
Yeah,
would
for
think it would
sure.
be important.
Yeah, for sure. If you already are at risk or have heart disease, let's say you may be obese and have diabetes and high blood pressure, right? That's the triad we see all the time. And then you develop cancer, your oncologist might want you to follow along with a heart doctor, especially if the medicine that they're going to treat you with or the radiation is close to the heart or known to be cardiotoxic. Absolutely, you should be seeing a cardiologist as well. And as you mentioned, there are certain tests that we can do to see if it's having any effect on the heart, right? EKGs, those echocardiograms, those ultrasounds of the heart, because we can catch things early by doing those. And many times when you're on chemo, we do those echocardiograms every 3 months or so to be sure that it's not changing the function of your heart. Even before you might have symptoms, we might be able to see changes on your ultrasound.
Kenya said her doctor set her up with a heart doctor before she even started treatment.
Good
Which
job.
is,
Yes.
yeah, which is a good thing. I feel like it should be throughout the treatment, especially if you know how harsh this chemical is. I don't think you should just take it for granted that, oh, okay, the cancer is gone. It did what it's supposed to do. Now the rest of your body is okay. No.
Yeah, yeah. And we see effects of those drugs up to years, decades later, right? And you'll hear me always talk about getting your checkups, right? Even more important, to follow up with your providers, because you may not have had symptoms right after your treatment, but sometimes those sequelae can happen later, especially if it was cardiotoxic, but then you got a little bit of high blood pressure from that. And then your heart muscle has to work even harder, and then that can lead to problems.
I've never heard of cardio toxicity before until now. Like, I guess when you think about well, I didn't really think about the seriousness of them, looking at the heart first to see, okay, is she going to be able to withstand these chemo treatments, or is she going to have heart issues in the middle, and then we're going to have to stop and maybe go to something else that may be safer on the heart.
Yes, and it's unfortunate when we can't give, right? When your oncologist can't give a certain medicine that may be very good for your cancer, but horrible for your heart, right? And so we look at that cardiotoxicity. What does studies show us about certain meds? I always think about the oldest one, adriamycin. We know that cancer drug can be very cardiotoxic, right? So even while you're on it, before you start it, they want to be sure that your heart can withstand that. And again, advocate for yourself. If there's something different that changes during your journey on that medication, bring it up. If your doctor hasn't talked about you seeing a cardiologist, but you have a history of high blood pressure, maybe bring that up, advocate for yourself, right? Because the idea is we always talk about catching things early, so that they don't get worse, and so that we can even prevent more complications later in life, from that. And then lifestyle changes, before, during, after. We know that exercise, if all you can do is a 30-minute walk, that's even good for you, right? For a number of reasons: stress relief, blood pressure lowering, cardiac, exercise, all of that is good for those lifestyle changes, good diet, all of that before, during, and after.
Kenya said that's exactly what her doctor said. He wanted to make sure that there was nothing wrong with her heart so that she would have no complications.
Good. Yeah. So take this information and share it with people, right? Because they may not be listening today, but we probably all know someone with cancer. We all know someone who's had heart disease. And so, help them, and educate them that, hey, has your doctor mentioned that to you? Are you having any symptoms? Have they done an EKG or echo and things like that?
Some of the most common side effects they say that come from the cardiac side effects from cancer treatment. You mentioned the fatigue, the trachycardia, the hypertension, and they also mentioned the coronary artery disease, the congestive heart failure, and blood clots, abnormal cholesterol, like
yes, all of yeah, all it can damage all aspects, right? So the congestive heart failure, right? Because we know that some of those drugs can weaken the heart muscle. So when we think about heart disease, there's all types of heart disease. Is there a heart arrhythmia, an irregular heartbeat? Is it coronary artery disease, which is the cholesterol plaque buildup in the arteries? Is it a muscle issue? Is it congestive heart failure where the muscle is not pumping very well? And we know one of the main things that these drugs can do is affect that and weaken the heart muscle. Where you get heart failure, you start to retain fluid. One of the first signs we can notice is a little bit of swelling in the feet, even before someone might get short of breath, right? We might notice that. We might notice that maybe they get a little bit more fatigued. So, and even as you said, blood clots, that's the other thing. And blood clots can travel to the heart. and cause major issues. So chest pain, shortness of breath, fatigue, things that you might think of just normally with cancer. I'm just tired, but please report those to your doctor.
And this is with not just the chemotherapy, but this is with the radiation therapy, the targeted therapy, the immunotherapy. So it's not just chemo, because I know,
Right.
maybe, oh, it's just from the chemo. I didn't get chemo, so I don't have to worry about it.
Right. No, radiation can be very damaging. And that's why when you go to get radiation, they try to shield all the parts of your body that's not in the field of treatment, right? Because we know that even radiation can cause damage not only to the skin, but the organs underneath the skin. And so we try to make sure that those organs are protected. So certainly, if you're getting radiation to your breast, that's in the field of your heart. And so you want to be sure and be aware of that as well.
Wow. So it's everybody that has these therapies, are they at risk for heart disease?
Everyone who gets these certain drugs can be at risk. Those who are more at risk are the ones who already have risk, right? Diabetes, obesity, high cholesterol, high blood pressure. We really want to be careful with those folks for sure. But it can happen to anyone. But we're even more concerned about those who already have some increased risk.
So when do you think it's a good time to go see your cardio oncologist? Like, is it if
Right.
you're having issues while you're taking the therapies, or at the beginning, or
Yeah.
throughout your treatment?
Yes. So definitely have a conversation with your provider, right? So what is your risk? Not every person who's going through a cancer treatment journey has to necessarily see a cardiologist or a cardio oncologist, but you should at least be evaluated, right, to make sure you don't need to see the specialist. And I'm sure providers are doing an EKG. That's the minimal, right? Put the electrodes on you, make sure the heart is beating good, make sure that we don't see any evidence of an enlarged heart, which we can see on an EKG as well. Take a good history and physical, right? Blood pressure, all of that. And then in certain people, they may need to get that echo ultrasound picture of their heart and need to see a cardio oncologist, right? But it starts with a good history and physical, like we learned in medical school. A good history and physical can tell us who really needs to see the specialist.
Sorry, my little chihuahua is
Oh, he's
excited
cute. Okay,
whenever he hears somebody else coming.
that's right. Yeah.
Yeah. So sometimes I know the symptoms don't show up right away, and I think this is one of those long term symptoms that we heard it first. I think I heard it with long term COVID, like the symptoms don't come immediately. Like I know someone who went through cancer treatment, but she ended up getting had a bypass surgery, but it was like 10 years after treatment.
Yes, right. And that's the thing. If you've ever been through cancer treatments, you have to be vigilant. You have to be aware of your numbers. We always talk about know your numbers, what's your cholesterol, what's your blood pressure, what's your sugar, because that way you can take preventative measures so that it's well controlled and you don't get to the point where you need bypass surgery, right? Bypass surgery is the last resort. And if we can catch things sooner, um, we should never get to bypass surgery and to that extent. But it happens, right? It happens. But I think we always talk about moving from awareness to action. The main thing is really know your numbers. And the way you know your numbers is by going to the doctor and getting your checkup, getting your blood work, talking to your provider, and then knowing that ongoing, because as we said, for decades after a treatment, things can happen. But even if you have received chemo, radiation, or immunotherapy, it doesn't mean that you will have heart disease later, right? It means be more vigilant about taking care of your health, exercising, eating plant-based foods, trying not to expose yourself to a lot of toxic things, walking, all the things we talk about. If you smoke, quit smoking, all of that, keep your diabetes under control, all of those things, those lifestyle things you have to continue for the rest of your life. And just knowing that yes, because you received a certain treatment, it puts you at risk, but there are things within your control to prevent it from getting worse.
I saw something that talked about since survivors, cancer survivors, are living longer. We're living longer enough than they did in the past, so that these issues are developing later in life. Like sometimes these issues probably was going to develop, but later in life. So since, we're living longer, they say due to, medical treatments improving. So now we're running the risk of developing these cardiovascular diseases.
Right. Great thing about all the great treatments we have for cancer, right? It's allowing people to live much longer lives, and we know that even the older population today is more conscious and more aware of their health than maybe years and decades ago. And so they're being more proactive, right? The good thing is there's lots of, sometimes it's good or bad, but there's lots of places to get information, lots of places to receive good education about how to manage your health into your later decades, right? And we've talked about that a lot on your show. And, the main thing is if you're not moving, get started moving. If that's 10 minutes a day of walking, finally spring is around the corner. If it's walking for 10 minutes, if it's walking down the block and back, but get moving, because that's one of the best things you can do for your overall health. So it's one of the things I really do stress if you're able. And even if you can't walk, you can do chair exercise, chair yoga. There's so many different things.
And I always say break it up, because we complain, Dr. Michelle, that, oh, we don't have time. I don't have time, I'm busy. But you can break it up too. You could do 10 minutes in the morning. You could walk at lunch for 10 minutes and then come home and do 10, or break it up into 15 and still get it. I even heard that if you do every 45 minutes, like especially if you're sitting at a desk, you can do, I think it's like 10 squats, and that would give you the equivalent of walking 30 minutes. But you have to do it every hour for those 8 hours.
Yes. The great tip, right? For people who, in today's world, we sit a lot at our desks, we're working from home, the work life is a lot different. It might be something like that, right? Sometimes I'm at my desk a lot during the day. I have little 5-pound weights by my desk. I might just do these, and I'll do some things, or I'll do some squats. And that's real life, because sometimes you have to fit it in where you can get it in. You don't have to plan a whole hour or two at the gym. Okay. That's sometimes just not doable.
Yes. I saw this video on TikTok, and it talked about how to lower your blood pressure, and you do a wall sit. So you do 2 minutes, but you do it for 8 minutes. So you do 2 minutes and then you stop, and then you do another 2 minutes until you complete 8 minutes, and it drops your blood pressure. I think it's like 10 to 20 points. Or you can they have a breathing exercise you could do where you're breathing in through your nose and then you're humming as it's coming out, and it lowers your blood pressure. And I tried it and it did work. So just like little things that you could do to take the pressure off of your body and off your heart, that doesn't really take that much time. But
that's so true.
You have to make it, Dr. Michelle, like a part of your lifestyle if you want to have a life or a good quality of life as you get older.
Yes. Yeah, you have to break it into your day. I started, and we've talked before, I started taking yoga like a year or two ago. But the things that I learned there is just what you said. They talk to us about breathing in and humming out of your mouth, and what that does to the vibrations and to the calming effect of that, right? And so there's a lot of things that you can do right at your desk, on your lunch break, like you said, it all adds up. That's the great thing about medicine is we don't want you to spend a whole hour trying to figure out how I'm going to get an hour of exercise in. My doctor says I need to exercise 150 minutes every week. Where am I going to find that, right? But you can find it if you break it up. We didn't say you have to do it all at once. We didn't say it had to be 50 minutes at a time. It can be any amount, a 10-minute walk, 5 minutes here or there, but just get moving. I mean, that's the big piece.
Yes, I'm gonna share this video, Dr. Michelle. I'm gonna put it on my page, and it's a 17-minute video, and the whole video is walking. But by the time you finish, you would have walked a mile.
Mm-hmm.
And
Yes.
it's so easy, and the movements, it gets your heart rate up, and then it helps you bring the heart rate back down.
Yeah.
But 17 minutes out of your day, and you have walked a
And
mile.
you've done it. Yes, I actually, you should say today, because it was 50 degrees out, I finally took my dog out for a walk, and we walked 1 mile, and it took me about 15 minutes.
See?
But we walked a mile. And so if you can just do that and think about, okay, if you have a dog, the dog needs to be walked anyway, right? So just make it a 15-minute walk and make it kind of a brisk walk. We don't want you to necessarily just stroll, right? We want you to be able to feel that your heart rate's a little bit up. You can still maybe have a conversation, but you get a little breathless. That's the best type of, a walk. So now that the weather is getting better, everyone get out and enjoy it. Yes.
Yes, Kenya said, that's what I don't understand. It's like when I finished treatment a year later, I was diagnosed as pre-diabetic, and then 6 months later, I was diagnosed as diabetic, and I'm not sure because I'm still eating the same way and drinking plenty of water.
Yeah, and that's a whole topic about diabetes, right? So you can certainly be at risk for diabetes and sort of doing the right things, but it may still develop if there's certain foods, it's carbohydrates, it's some genetics, are we exercising regularly to help maintain those sugars. I actually just saw on the news before our show, Lady ReShell, about the continuous glucose monitors, right, that they use for diabetics that are now being sold over the counter apparently, and that people like to use them because it can sync to their phone. And it's not just for diabetics. You'd have to purchase it, of course, if you're not diabetic, but you can then monitor for yourself how your sleep affects your sugar, how that pizza you had affects your sugar. I mean, all of those things, right? Because sometimes we think we're doing all the right things, but everyone's body reacts to certain foods, carbs, sugars differently. And I always am talking to patients about, okay, well, you ate that rice and chicken. Did you check your sugar after to see how it affected it? And sometimes they don't want to check their sugar, but if you have a continuous glucose monitor that syncs to your phone, and it can alarm you if you set the parameters at, okay, tell me if my sugar goes over 150, it'll ding when your sugar goes over 150, and then you'll know. So there's so many things that are coming down the pipeline, even about how we can manage our health and wellness even before you might have a certain disease. That is great. Technology is great for that. But if you have diabetes now, you can work on that and get it under control so that hopefully you don't need, if you need medication, not more than one or none, and don't have to get, injectable things. But there's so many options now, even when you have diabetes.
It's almost like you have to just eat just raw food, like nothing cooked or prepared. I feel like that's where it's going in order to benefit, in order for it to benefit your health. That's what it seems like to me. It's like anything that's cooked or you buying from the store, or maybe you're not growing it out of your own garden, but you're getting it from the store, and they're having to put all of these things on it to preserve it, and then you get it home to cook it. The meat, they're putting dyes in it to make it look pink and pretty, so you would purchase it. And even like the chips and stuff we eat, the candy, is like you really have. Sometimes we think we're eating healthy, because let me tell you, I was a vegan for a while, since 2018. So sometimes think you're eating healthy, but you're really not. You're really doing damage to your body. So me being a vegan and not eating meat, but I was still eating other processed foods. And processed foods, I mean, like maybe it could be a snack bar, it could be a bar that was, a snack. It could be chips, a cake that's already, cookies, right? Those are processed things.
Right.
But I find that now I'm more towards preparing my stuff at home. For the last 2 months, I've been bringing my lunch every day.
Good.
So I know exactly what I'm eating.
Yeah.
I know how much salt is going in there, how much salt is not going in there. I stopped using salt altogether, so I just used a dash, and I'm used to the taste so that I won't have to worry about it. And now I look at labels. So when I'm at the store, I say, how much sodium? Oh no, I can't have a lot of sodium.
Oh yes.
And even like your staple foods, like the dark chocolates, you can do for people who don't eat meat, like the pumpkin seeds and the stuff that I know that I could get my proteins from, the avocado. Like I'm leaning more towards those things. And even with like monitoring my blood pressure, I'm eating a grapefruit every day, right? I'm making sure that I'm exercising at least 6 days a week. I'm getting my exercise in for 30 minutes. And there's a lot of improvement that I can do. I struggle with getting my water in. I struggle with getting the adequate amount of sleep that I need. So those are two things that I know that I can work on that would probably help bring my numbers down and bring everything into alignment. So, I mean, we all have work that we could be doing, that we need to do. And it's not going to happen overnight. It's going to be something that you're going to have to incorporate and just make a conscious decision every single day to do it.
Yeah. Yeah. I mean, you're doing great, and you're right. You make a lot of great points, right? So first, from the foods, we know that eating plant-based, eating raw is best, but you got to be sure that it's not pesticides on your raw. It should be organic. I always say, if you, when you talk about fruits, if you can eat the skin of that fruit, it should be organic, right? Like your apples, your strawberries, right? You don't necessarily need organic bananas because you take the skin off. But things where you eat the skin, you should try to go organic when you can. And then, we all have to just make little changes, right? Because as you just mentioned, it can be overwhelming when you think about all the things that you need to do. But set a small goal for those, that feel like, oh my gosh, I just heard all these things I need to be doing. Maybe set a small goal. Maybe just say, for breakfast, I'm going to try to eat plant-based and not eat bacon. Or maybe it's, I'm going to walk 10 minutes this week, and next week I can walk 20 minutes, So set goals that are achievable, but, not too easy. And that will get you on the right track.
Yes. And because I was eating these waffles in the morning, right? The waffles that's already processed. So I would just heat the two up and, put my little syrup on it, and I'm eating it on the way to work. And I just happened to look at the sodium on the waffles, and it was like about 500 and something for the two waffles. I said, you know what? I can't do the waffles. So
you wouldn't think that for
waffles. No, it's just two little waffles. Right. So I started doing oatmeal. So I do my oatmeal. I put some fruit in it. I put some granola, and even you have to be careful with the granola. It could be sweet. And I use brown sugar, but brown sugar is still sweet. It's still sweet, but I opted to use that versus the white sugar.
Yeah, and it's making changes.
Yeah, and then I do my my almond milk, which has 3 ingredients in it, and so that's my breakfast in the morning. And then I do my green tea once I get to work. I have a piece of fruit, and I try to get snacks or bring stuff that I know that maybe I prepared or it's really low in sodium. So
yeah. And it's how we prepare our foods, right? We have to be cooking it healthy. We should use, extra virgin olive oil when you can. I mean, you have to do the little changes. And I always say, if you have access to, through your insurance, a nutritionist or a dietitian, if you are diabetic or something, you should have access to that. Someone that can walk you through. Because if you've never learned how to read labels, how much sodium you should have, you won't be able to even start. right? Because it's hard to change old habits if you don't have the knowledge to do that. So I always say use your resources where you
Yeah.
can.
Yes, I remember when I was going through my cancer treatment, and at the time I couldn't eat, and so the doctor referred me to a nutritionist, and I was asking her like, okay, what kind of supplements can I take to make sure I get everything in my body? And she was like, none. And she was like, we're gonna get
Get
it
your
through
food.
food. Yes, get
Right.
it through food, and if you're doing everything you need to, and you need to supplement, then we'll talk about that. But we're
Right.
gonna work on getting it through your food first. And I was really shocked because I was just waiting on her to prescribe me something. No.
Right. Because we know the supplement industry is a billion-dollar, multi-billion-dollar industry, right? Because people are looking for the quick answer
Yeah.
to their ills, but it really is food is medicine. We always say that food is medicine. So, but in certain communities, it's hard to get the best
It,
foods. We know that, right? There's disparities, there's food deserts, it's the cost. There's so many things, right, that lead certain communities to not have access to the things that they need to be healthy, and that's why many diseases run in the African American community because of lack of access and resources. It's not nothing necessarily genetically
right.
different. It's
Environment.
access.
Yes.
Yeah, it's environment.
Yeah.
But when you can, learn those things that you can. I like the Mediterranean diet. I always recommend that. It's Googleable. You can find all the things that you should be eating there, plant-based, your nuts, your beans, all the good things to keep your heart healthy.
Yeah. Kenya said now that may be her problem because she doesn't get adequate sleep.
Mm,
And
yeah,
you're not,
adequate.
yeah, adequate sleep. You're not by yourself. I think what I have been trying to do is like little baby steps, like maybe going to sleep an hour earlier for the week. Like, okay, that's gonna be my goal for this week is to get in the bed an hour earlier. And then maybe if I could do that for a whole week or 2 weeks, and then say, okay, you know what? Let me try to get in the bed at least 2 hours earlier than I'm supposed to. And then not eating so close to when you go to sleep
Right,
as well, right? Because your body is going to have to break all of that down while you
right.
sleep. So, not eating and exercising like right maybe a couple of hours, maybe 2 to 3 hours before you go to sleep so that your body can do what it needs to do. But
Yeah,
it's just going to have to be something that you're just going to have to put your foot down and be like, I got to go to sleep. And turn the
you
cell
have to
phone
do
off.
it.
I
Yeah,
just got to do it.
yeah. You have to. We aim for 7 to 9 hours. If you're
Yeah,
getting
that's
six and a half,
it's
anything
so
less than
long.
six, it's stress to the body. You got to aim for 7 to 9 hours. And like you said, sometimes it's hard to do it if you've really been focusing on five, but like you go a half hour, an hour, and do that until you're used to it. And then actually studies show if you are able to get a nap during the day, that's great too and helps to lower your blood pressure and your stress level. If you can squeeze in a 20 to 30-minute nap, do it. Sometimes we feel guilty and we don't do it,
Yeah.
right?
I be
But
like,
do it.
I could be doing this instead of going to sleep. Like I be
Yeah.
thinking of stuff I can do instead. Like I don't want to be sleeping. I could be doing this. Leah says I'm working on better sleep patterns too. I think
Yes.
that's everybody can, especially with that. I just have to, and I think it trickles down to my children too because if they see me, going, they're like, oh, okay, we don't need that much sleep. And they need their sleep because they're growing right now. And those are things that
Yeah.
they're going to take with them as they, become adults. So yeah.
And they have sleep apps, those that sort of white noise that can help you to fall asleep. So I like and recommend those too.
Oh
So
yeah.
put your phone to good use.
Yes, absolutely. I wanted to get in some of the myths that come along with cardiovascular disease because we are again in heart month. And so we want to make sure that individuals are getting all of the information they need when it comes
Hmm.
to having a healthy heart or making healthy decisions when it comes to your heart. So we know that there's a lot of information that floats out there that can be misconceptions when it comes to your heart and what you should
Yes.
do.
Yeah.
So the first one, Dr. Michelle, is I'm too young to worry about heart disease.
No, you're never too young. Okay. Heart disease we start building up little cholesterol plaques in our arteries in adolescence, in our 20s, right? And so you may not have symptoms until later, but the idea is prevention and healthy lifestyle in your teens, 20s, and as you talked about your kids, teaching good habits to them as well, so that they grow up with those healthy habits and don't have to worry about the heart disease later. But we even recommend over if you're over 20, you should at least have had your blood pressure checked, one cholesterol check, and depending on the results, they'll tell you how often it needs to be checked.
Number 2 says, I would know if I had high blood pressure because there would be warning signs.
Unfortunately, as we've talked about with high blood pressure, there are no warning signs, right? Because it's called a silent killer. You can have a blood pressure of 150 over 90 and you may have no symptoms, right? But that over time damages your kidneys, your heart, your blood vessels, puts you at risk for stroke. So there are no symptoms. The only way you will know is to know your numbers and check your blood pressure, either ambulatory blood pressure cuff or go to the doctor for sure and let them check it at least once a year, more often if you have other illnesses.
And they do have it, like I think it's Walgreens and CVS. Sometimes they have the little thing where you can sit there and get your blood pressure checked.
That's right.
And it's free.
That's right.
So
sometimes the pharmacist will check it for you, so there's no excuses for that. You should know.
So the third myth is, I know when I'm having a heart attack because I'll have chest pains.
Absolutely false, right? Because we think, I'm going to have crushing chest pain when I am having a heart attack. But no, sometimes it's arm pain, jaw pain, nausea. I tell the story about my mother. She didn't have a heart attack, but she was complaining of heartburn for years. By the time we got her, she actually was having heartburn and was getting treated for that until I noticed she couldn't walk about a block without stopping. So we went through the process and turned out she had significant coronary artery disease, which could have led to a heart attack. And so your symptoms can be very varied. And so the idea is, if something doesn't feel right, if something is persistent, bring it to your provider's attention.
So number 4 says, diabetes won't harm my heart as long as I take my medication.
Yeah, unfortunately, that's not true either. Diabetes, even well-controlled diabetes, puts you at risk for heart disease because the same risk factors that cause someone to get diabetes are a lot of the same risk factors that put you at risk for heart disease, right? So the diabetes could be under control, but is your cholesterol under control? Is your weight in a normal range, right? Are you a smoker? So you have to think about all the pieces to keep your heart healthy. Great to control your diabetes. That's one piece of the risks that you may have.
Number 5, heart disease runs in my family, so there's nothing I can do to prevent it.
Right. Not true. As I said, my mother had heart disease, but there's still things that you can do, right? So that there's a genetic component, but a lot of it is also lifestyle. And that's stopping smoking if you smoke, that's exercising, that's eating the right foods, that's controlling your diabetes, knowing your blood pressure. So all those things, even if you have a family history, there's so much that's in your control to control your health.
I always say genetics loads the gun and lifestyle pulls the trigger.
That's right. That's right. Yeah.
Number 6, I don't need to have my cholesterol checked until I'm middle age, whatever that is.
Right. And that is definitely not true, because I've had young people in their 20s that have had high cholesterol, right? There is also a genetic component to high cholesterol. And so some people, you look at them and they look that they're just perfectly healthy, but you can still have high cholesterol. So please, if you are in your 20s, you should have at least had one cholesterol check to make sure that it's normal. And then depending upon that result, you may get that checked once a year.
So when you're doing your annual, are they checking the cholesterol? Okay.
That's right. Yep. As part of your annual labs, a whole lipid panel should be part of that.
Heart failure means the heart stops beating.
No, heart failure can encompass a lot of things, but that's really where the heart muscle is weaker. And so instead of pumping nice and strong, it pumps very weak. And so that causes fluid buildup, shortness of breath, blood pressure issues, but it's not the heart stops beating is different. But heart failure is very manageable with lifestyle, with great medications that we have now as well.
Number 8 myth when it comes to cardiovascular disease, the pain in my legs must be a sign of aging.
That's a good one, right? Pain in the legs doesn't have to be a sign of aging at all. It can be a sign of peripheral arterial disease. So blockages in the leg arteries, right? And so if you have, we think of if you're walking and as you're walking, your legs get achy, they start to hurt, they feel like you can't go much further. That could be a sign of peripheral arterial disease, which needs its own diagnostic testing. But if you have peripheral arterial disease or pain in your legs, it could also mean you have blockages other places, like your heart. And so, if you're diagnosed, if you're out there and your doctor said that you have peripheral vascular disease, peripheral arterial disease, you should have also had your heart checked out as well.
Number 9, my heart is beating really fast. I must be having a heart attack.
No, lots of reasons for your heart to beat fast. If you're exercising, there are arrhythmias, irregular heartbeats that can cause your heart to beat fast. We call them palpitations. If you're noticing that that is happening, definitely bring that to your doctor's attention as well at any age. If your heart is racing and you haven't just done, a workout, that could be a sign of an irregular heartbeat, and that needs to be addressed.
Number 10, when it comes to myths about cardiovascular disease, I should avoid exercise after having a heart attack.
Definitely not. That's why we have cardiac rehab, cardiac rehabilitation after people have a heart attack, because we know and studies show that if you can get back to regular exercise, it actually helps your survival and your morbidity, like how well you live after you have a heart attack. So get moving. At first, it's supervised exercising. Once you go through that for about 6 weeks of cardiac rehab, they set you free to continue your exercise program.
Ooh. Well, that is our show for today as it relates to the impact of cancer treatments on your heart. And we also gave you other heart healthy tips that you can use and incorporate into your life on a daily basis. Dr. Michelle, can you give us some words of wisdom on today as it relates to having a healthy heart?
Yes. So today I just leave you with be aware of your heart, your body, know your numbers. For if you have been through cancer treatment and you have had medications, radiation, chemo, or immunotherapy, just be sure to continue your follow-up with your doctors to ensure that you're not developing any heart disease, and continue a great lifestyle, plant-based diet, get moving, get moving, get moving. It's the best thing you can do for your health.
Awesome. Kenya said, thank you, ladies. Thank you, Kenya,
Thank you.
for your feedback. We enjoyed it. And thank you to everybody that tuned in. I'm going to highlight my sponsor today, which is Gloria Dotson with Mary Kate, and she's catering to all of your beauty needs from head to toe. You can go to her website at marykate.com/GDOTSON. And as always, Warriors Talk is always looking for individuals to share their testimonial journey as it relates to cancer or healing. You can inbox me at warriorstalk1@gmail.com, or you can inbox me on Facebook as well. All right, you guys, thank you for tuning in to Warriors Talk. I will leave you with these words of wisdom on today. Healing takes courage, and we all have courage. And even if we dig a little bit, we can find it. So join me next Monday at 6 p.m. on Intellectual Radio. As always, thank you for tuning in to Warriors Talk with author and founder Lady ReShell. where we are changing lives one warrior at a time.